Good morning. I'm Jessica Moore.
And I'm Kevin Rincon. We have breaking news in the battle against the Omicron pandemic right now.
Mayor-elect Eric Adams is holding a news conference to unveil his COVID plans as he prepares to take office on January 1st. Let's listen in.
First of all, happy New Year's coming. We're all excited about that. And I'm happy to be joined by real heroes on this fight against COVID. To my left, Dr. Dave Chashi, and we really want to thank you, Doctor, for having a problem with the fee.
The mall box.
One, two. You guys are good? Okay. Again, I want to my left, I want to thank Dr. Chashi, who has been really on the front line for our entire city of dealing with the fight against COVID. Also online, we have our incoming, our new leader that's going to be coordinated with Dr. Chashi, incoming Department of Health and Mental Hygiene Commissioner, Dr. Ashman Fasan. He will be speaking in a few moments. And to my right is First Deputy Mayor Lorraine Grillo. And to my far left is Deputy Mayor for Health and Human Services Ann Williams Isam, and our entire team that's here. I want to thank everyone. And so we are at a critical moment in our fight against the pandemic. And I have been extremely careful about not adding to the confusion and the anxiety, because this pandemic has not only impacted us physically, but it has impacted us emotionally. And nothing is more alarming to New Yorkers as I move throughout the city than the feeling of uncertainty from the leadership. And I was careful not to in any way impact on the existing mayor's ability to send a very coordinated message to New Yorkers. I was really happy to join Mayor de Blasio and Governor Hochul. As we stated together, we're going to fight the increase in new cases of COVID, particularly this variant. And today, at the eve of my ability to become the mayor of the city, I want to be clear on giving the message of what our winter plan is going to look like. A clear plan of how we're going to continue the effort of ensuring that we aggressively go after the increase in spikes and deal with COVID. COVID is a formidable opponent. I've said this over and over again. Its ability to change new variants, its ability to continue to impact us shows how formidable it is, but we're going to have a formidable response. We're going to meet the surge with an increase in how we coordinate and actively address this issue. The numbers tell the story in a real way. Over the past 2 weeks, positivity rates citywide, they have jumped from 7.7 to 21.7%. It's enough to be concerned about. Hospitalizations are on the rise as well. But thankfully, the data suggests something that we must really focus on. The variant is milder for vaccinated people. You know, we need to be clear. Vaccinations and boosters, those are the best weapons in our arsenal to deal with COVID. That is the most important message we're going to continue to hammer home. But we cannot let down our guards because we're seeing the success of vaccination. We're going to remain vigilant and continue to tell New Yorkers to do what you have done so successfully. Everything from wearing your mask, social distancing, washing your hands, all of those things are just so smart. And not only has it helped us with COVID, but it has also helped us during the flu season as well. And we know now it's clear that we need to learn more with COVID so that we can recover and thrive as a city. We must allow our city to function. We threw $11 trillion at COVID. So the day has come when we must learn to be smarter, live with COVID, and ensure that we protect everyday New Yorkers, and that is what I'm going to do. And so that's why today I'm rolling out my administration plan to keep New Yorkers safe from the virus and keep our city open. That's the goal. We can't shut down our city again. We can't allow the city to go further into economic despair, and I'm going to put in place a comprehensive plan that we're rolling out today. It was created with extensive input from public health leaders all over the city, the state, and federal government to come up with smart decisions. I led with one thought in mind: we're going to follow the science. The science will ensure that we can effectively deal with this COVID surge. This is going to provide updated rules and guidance on COVID based on the latest recommendations that we are receiving from all information that is happening globally. Our focus is vaccine and testing, vaccine and testing, vaccine and testing. We must say that over and over again. Someone needs to make a T-shirt and a cap that says vaccine and testing. This is the clear message we must get out. It is our most potent weapon, as I say over and over again. We're also making investments in our healthcare infrastructure to get through this surge and keep our system strong. That's crucial. And we will look towards the importance to arm ourselves with the next wave of fighting COVID, and that is the antivirals. With these pills, when these pills become available for mass distribution, we're going to ensure that it is done in an equitable fashion. We saw at the beginning of COVID, there was a failure to have an equitable distribution of testing and equitable distribution of vaccinations. We're not going to do this with these antivirals, and we need to ensure that in a very equitable way, we get it across our city, particularly in those communities where we see a greater need. And we should commend ourselves. When I was speaking with Dr. Chosky earlier, he shared with us that many of us don't understand the last pandemic, we did not have modern science move at this rate. We saved lives because modern science came together to come up with vaccines, as well as we look at the new wave of antivirals. And we should be looking at the positive side of how we coordinated as human beings globally to fight this virus. And so with this plan that we are announcing today, we will prepare ourselves to get through the winter surge and get back to living our lives. And so I want to again thank New Yorkers. I saw you at the beginning of this virus. I saw how you responded, even with fear and lack of understanding what the future was going to look like. You stepped up. We did the right things when we had to stay shelter in place. Those countless number of New Yorkers, from transit workers to police officers to EMTs to those who worked in supermarkets and school systems, we all stepped up together and we adjusted, and we have to adjust again. We are resilient as a city, and we will continue to be resilient as a city. And together we're going to get through this. Trust me, we're going to get through this, and we're going to open our city, and the city is going to thrive. New York will lead the way for this entire country to follow. So to roll out our plan, I want to now introduce Dr. Chokshi to give the detailed overview of our plan. Doctor?
Thank you so much, Mayor-elect Adams. New Yorkers have been through so much over these last 2 years, and this latest Omicron wave has unfortunately touched all of us in some way. But as we enter our third year contending with the coronavirus, we are stepping up once again to meet the challenges facing our city with renewed vigor. Today, we're proud to announce a comprehensive plan to address COVID-19. As we enter the new year, we will drive down disease and further drive up vaccinations citywide. with a constant commitment, as the mayor-elect said, to saving lives, ensuring equity, and keeping our city open. The plan revolves around 6 pillars, which we will discuss in detail today. First, vaccination. Second, supporting hospitals in congregate settings. Third, testing. Fourth, treatment. Fifth, slowing the spread of the virus. And sixth, finally, safer schools. So first, our most important public health tool, which is vaccination. We have made incredible progress on getting New Yorkers vaccinated. Over 72% of all New Yorkers are fully vaccinated, reducing their own risk of severe disease and also helping to protect their communities. However, there is more to be done. The private sector employer mandate will stay in effect in the new year, with a focus on compliance, not punishment. The mayor-elect has charged the incoming team with standing up a dedicated unit to work with employers, foregoing fines so long as employers help get their staff vaccinated. We know businesses share our goals of keeping their staff and their clients safe and their doors open. To put it simply, COVID is bad for business, and vaccination enables not just health, but also a healthy economy. We will also study the need for what we're calling the up-to-date mandate, which would require New Yorkers to have their booster shots under the vaccine mandates currently in place. Studying it encompasses both following the emerging science on the importance of booster doses with Omicron, as well as understanding the impact of the mandate on the settings it would apply to by engaging with unions, the business community, and other partners. In the same vein, the city will set a deadline of this spring for a decision about a vaccine mandate in schools to commence later in 2022. The second pillar is ramping up our work with hospitals and congregate settings to shore up their capacity during the winter surge. I've been in regular touch with hospital leaders over the last several weeks, understanding what they are seeing and experiencing, and yesterday I was at my neighborhood hospital, Elmhurst. Our hospitals are among the best in the world, and they are now quite experienced with COVID, but they will continue to need our support, particularly for staff who have already borne so much. We will resource our health and hospital system to ensure we have the capacity to address new hospitalizations as a result of the Omicron wave. Dr. Katz and H&H have already begun shifting to virtual ambulatory care services and are reinforcing nurse staffing levels. And we will improve safety in our congregate settings, like shelters, nursing homes, and jails, for some of the most vulnerable New Yorkers. We will reduce risk for residents and staff by supporting rapid isolation and quarantine protocols, and ensuring that these sites have adequate testing and vaccination resources, such as additional booster clinics in nursing homes. And now let me move to our third pillar, testing. Since the Omicron wave began, we've already added more than 60 new testing sites, but we won't stop there. Test and Trace will continue to increase the number of testing sites and ensure widespread access to rapid tests. Earlier this week, I visited our Bronx Neighborhood Health Action Center, hearing from neighboring NYCHA residents about how important free test kits were to them, either because they couldn't find any in a pharmacy or they were unaffordable. We will also provide clear testing guidance for specific settings, including the private sector. And I'm particularly grateful to the mayor-elect for his surging resources to the health department, including over 250 staff, to keep our public health infrastructure strong and nimble enough to respond to other needs as they arise in COVID response. With that, Mr. Mayor-elect, I believe I'm turning to my colleague, Dr. Ashwin Vasan, to speak to the rest of our pandemic plan.
Thank you so much, Dr. Choksi. Thank you to the mayor-elect and to the entire team for the opportunity to be here with you today to talk about the remainder of the winter pandemic plan. I want to start by saying we are in an entirely different place than we have ever been in our response to this ever-changing pandemic, in part because of the range of tools in our toolkit, including vaccines and testing, as the mayor-elect and Dr. Choksi have emphasized, but also in several promising findings about effective treatments for severe cases of COVID-19. In our winter pandemic plan and in our ongoing work to combat this virus, we will aim to increase access to monoclonal antibody treatments, sotrovimab, as well as oral antivirals, including Paxlovid and molnupiravir, with the focus on equity and on reaching underserved and high-risk populations. Next is our work to slow the spread of the virus. We all know the Omicron variant is highly transmissible. Slowing the spread is going to require strong coordination of our resources on the ground and clear lines of communication. In that vein, the city will distribute an additional 2 million higher grade, higher filtration masks, including KN95s, KF94s, and N95s in January, particularly via community-based organizations, health department, and H&H sites. This is a moment to really activate our community leaders and credible messengers to ensure that every community gets the resources they need. And masks are an important part, high-quality masks are an important part of our mitigation strategy in order to slow the spread. We are also going to invest in creating new ways of communicating with New Yorkers about the state of the pandemic. We will create and release a simple, color-coded system that shows the level of threat of the virus at any moment in time and communicates clearly what level of safety measures are in place across the city. And finally, to a critical component of our plan, which is schools. We know so many parents, educators, and children are anxious about what this means for our schools, what Omicron means for our schools, and how to reopen safely. To fully reopen on January 3rd, we will implement the Stay Safe, Stay Open plan announced on Tuesday with Mayor de Blasio and Governor Hochul. And we're going to focus on 3 things in particular: doubling surveillance testing in schools and adjusting the situation room and contact tracing protocols in partnership with the DOE, sending home millions of rapid at-home tests for students, educators, and staff, especially those who may have been recently exposed to a positive case, and strengthening our mitigation measures, including higher quality masks and improved ventilation in schools. So now I'm pleased to throw it to incoming First Deputy Mayor Lorraine Grillo to talk about the role of leadership and agency coordination in our pandemic response.
Yes, thank you, Dr. Vassan. I am so excited to be here today to unveil this plan. As First Deputy Mayor, it'll be my role starting Saturday to make sure that all of our agencies and departments are working hand in hand to defeat COVID-19. Under Mayor Adams' leadership and with the guidance of Drs. Choksi and Vassan, we will target resources and personnel to drive up our vaccination rates even higher while providing more testing to keep our city open. Every step of the way, we will prioritize engagements with stakeholders, including our unions, our business community, public housing residents, nonprofits, and community-based organizations to ensure the most effective and equitable approach to fight the virus. As the current COVID recovery czar and a lifelong public servant, I can tell you one thing for sure. When New York City has strong leadership and is united in a cause, we always succeed. The mayor-elect's plan in that leadership and the team assembled here are united in this cause to defeat COVID-19. So our message to all New Yorkers today is clear. We will be ready against COVID on day one. Thank you.
Thank you so much, Lorraine, and we look forward to your role that you played as the czar now and just that continuation of moving the city forward in a safe place. We want to now introduce Deputy Mayor for Health and Human Services, Ann Williams-Iso. Ann?
Thank you, and good morning. As the new Deputy Mayor for Health and Human Services, I will have the pleasure and the charge to work with First Deputy Mayor Grillo and oversee all of the health department, this very competent team, as we coordinate the entire healthcare infrastructure to attack this virus. That includes all the measures that we spelled out today, including vaccines and treatments, but it also includes all of the many programs and initiatives that already exist in the health department right now. All of that is available to New Yorkers against COVID through better health and wellness. We know, and this is so important, because we know that those of us who are in poor health are more susceptible to COVID. So there's certain things that I want to remind you of today. One is that all New Yorkers should get an annual physical checkup. I would also add to that to seek mental health professional help if you need it, because we know this is such of a difficult time, and all of us have to be ready to really deal with all of this surge that we're in. Sign up for the city's Metro Plus health plan if you do not have health care coverage. The simple things that we forget sometimes: eat healthy, get exercise, moderate exercise, go for a walk. It will help not only your physical health, but it will help your mental health. The City of New York has dozens of free health and mental health programs as well as mental health treatment. And I want to make sure that all New Yorkers take advantage of these so that we can stay healthy. In the coming months, we will be rolling out more initiatives to deliver these resources to New Yorkers. But for now, you can find more details at nyc.gov/health. I want to remind everyone to be well and stay safe, New York. Thank you.
Thank you so much, Doctor, and to all of you. And I think that what you raised is crucial because we stay in the space of the COVID space, but there must be a holistic approach. I talked about this on the campaign trail. In the next few months, we're going to roll out new initiatives in H&H. COVID caught us off guard. Those at the beginning of this wave who were more likely to be hospitalized or more likely to die, many of them dealt with pre-existing conditions, comorbidities. This is what we must fight against. And we're not going to be caught off guard again, and that is what we're going to do in our health and hospital system and our safety net hospitals. We're going to take a more proactive approach to health care. We now feed the crises, and it's time for us to stop doing that. So while we are in the crisis of this pandemic, my team is going to be operating in alignment to build out a better response to health care, proper food, proper feeding our children in our hospitals, using telemedicine, understanding how to align what we do every day in our city agencies with our healthcare system. This is our goal. And so I want to say to all New Yorkers, during this time of uncertainty, in a time of fear, you must understand we are going to get through this. We're going to get through this with facts and not fear. We're going to get through this by being prepared and understanding that there won't be a misalignment from the previous administration and my administration. We are coordinating together to make sure that we defeat COVID. And I am confident that we're going to look back on these days and be proud of how we responded as New Yorkers, as we have done so many times in the past. January 1st is a new beginning of my administration, but it's not a new beginning of our resiliency. We're a resilient city, and that resiliency will show the entire country how New Yorkers respond during a moment of crisis.
Yes, sir. We are going to do on topic, in person first. Amanda, Politico.
Good morning, everyone. Nice to see you. Thank you.
Good morning.
Good morning. I wanted to ask about the vaccine mandates in schools. This is a state decision to get any vaccine on the list of required immunizations. You need state approval. Have you spoken to Governor Hochul about, what that would look like? I understand you're studying it, but in terms of making sure children are safe in schools, what does that state coordination look like, and how would you address any issues around staff shortages concerning, people testing positive in rapid tests?
We have behind the lights. We have been in coordination with Michael Melgrew, who is the leader of the UFT. I cannot tell you how proud I am of the partnership he has shown. We have communicated with the governor to gauge her concerns around mandating vaccinations, and we have discussed our feelings on that. Right now, we don't believe the rates in schools calls for that. We said it over and over again. That is right now the safest place for our children on so many levels. The governor would make the final outcome if we're going to mandate vaccines in schools. I'm going to, those things that are state regulated, I'm going to lean on the governor, share my thoughts, but I'm going to lean on the governor and make that determination. And as we look at the numbers sometime in April, we'll see if that is something that we need to further look into. But I think at this moment, the schools are doing an amazing job. We're going to get 1 million plus tests to children. My team is coordinating right now on the ground with the governor's office and the city to get those tests in the hands of children to take home to do their tests. So I believe the plan is a good one, and then the governor will make the final determination if we will mandate vaccines.
News 12. News 12. Okay, Jacob, forward.
Hi, good morning.
How are you?
Good. How do you make sure that the policies that you roll out in the coming days and weeks are actually fully enforced? Make sure you don't sort of fall in that trap of rolling out a policy but not able to enforce, and restore trust in people who have, after 2 years, some have even given up on even complying, but also in sort of trusting government leadership. And to Dr. Chucks, if I may, how often should people who are boosted or have recovered the second time of COVID get tested if they don't feel any symptoms, in order sort of to get through that process of not spreading the virus?
So let me address the trust part and the ability to make sure people are in compliance, and the doctor will respond to your second question. The goal is to be cooperative and not punitive. We saw a punitive response. We're going to give support, and we're going to communicate. We communicated this new plan. We communicated with our business leaders, both large businesses as well as our small businesses, and we communicated with the unions. What I've heard throughout this entire pandemic is the lack of proper communication, and I'm not going to have that. And by using those stakeholders, they will translate the importance of us operating together, and we're going to go to those sites where people are openly failing to comply and make sure our city services are utilized to ensure compliance. But the goal is not to be punitive. The goal is to get our city up and operating, and we believe we're going to create that partnership to get it done.
Thank you, and thanks for the thoughtful question, which was about testing for people who are vaccinated or who have recovered. I'll just dissect it out briefly to be as clear as I possibly can. First, people who have been previously infected with the coronavirus, our strong recommendation is that they should get vaccinated as well. So if you are in that category, or if you're someone who is fully vaccinated or has received their booster dose, there is a question about testing in the context of Omicron, given how easily it spreads. And my advice is this. First, if you have symptoms, including mild symptoms, whether it's a sore throat or a runny nose or some fatigue or fever and chills, you should get tested as soon as you develop symptoms. So that's number one. Number two is if you are traveling, if you're having gatherings around the holidays, or if you've been exposed to someone else who has been diagnosed with COVID-19, we're also recommending testing in that case. Beyond that, we do not have a recommendation at this time for more routine testing if you're asymptomatic and in one of the categories that I described. Thank you.
New York Post.
Hey, everybody. To the testing lines, does your administration plan to bring back the 20 sites that were closed down by H&H because of the budget cuts? And does your administration plan to expand the city's city-run rapid testing programs beyond the permanent site at Times Square and the 8 DOHMH clinics that are currently operating?
Yes, thank you, Nolan. We have received and we are receiving a large number of take-home tests. We are going to really encourage New Yorkers to utilize the take-home test because that takes the weight off the system. I'm sure you have witnessed the long lines that are throughout the city now. And so we can get a mental shift to New Yorkers to know how to easily use the take-home test and how important it is to do so. We believe that's important. And then we're going to do a real analysis of the sites and get as many sites open that we can do the rapid testing as well as the overnight PCR test. That is what we're going to do to see how we can get that done because we should have a greater accessibility to tests.
Dr. Choksi, the rapid testing program is yours. Was it a mistake not to expand it beyond sort of the initial DOHMH sex health clinics?
The rapid testing program is something that's coordinated across the city, and from the beginning, we used rapid tests across city sites, not just at DOHMH sites, but at health and hospitals and test and trace core sites as well. So as soon as we had the supply of those rapid test kits, given, as you know, that there's a shortage across the country, we very rapidly distributed that across our network. Thanks to the test and trace core in particular, we now have 160 city sites as of the end of this week, and across that vast network, as soon as we get more rapid test kits, as the mayor-elect has said, we will continue disseminating them through those sites.
Forgive me for pressing, Commissioner, but it is your program. It is one of the very few options to get where someone can walk in and for free get a PCR test back in 3 or 4 hours, which is essential if you want to travel these days. Was it a mistake not to expand that program?
Thanks, Nolan. So you're asking a different question, which is the rapid PCR testing that is done at COVID Express clinics. Yes, correct.
That was the previous question, so that's my fault.
Right. It's just to clarify, it's different than the rapid self-test kits. So for the COVID Express sites, we are working with health and hospitals once again, who also have rapid PCR testing available to make that as broadly accessible as possible. For DOHMH sites, although we are contending with some staffing challenges, as many other healthcare institutions are right now, we will continue to work to make ours and the capacity as accessible as possible.
Africa in Harlem.
Good morning. With the new variant, we know that for the flu, oftentimes the city asks people to get the flu shot, but the strain that comes up might not be the one that people received. So do you expect to see that same issue with these different variants that show up? Because we see people who are vaccinated that have COVID now.
Thank you, and this is an important question. The mayor-elect and I were actually just talking about this earlier today. The short answer is that right now, the vaccines that we have available, the early evidence indicates that vaccination remains particularly effective for preventing severe disease, and that includes for the Omicron variant, based on data from South Africa, the United Kingdom, and some early early laboratory data as well. In terms of what will happen in the future, we do have to continue following variants as they emerge to understand whether the vaccines will have to be updated in some way. There's also ongoing research for what's called a pan-coronavirus vaccine, which would cover an even broader range of possible variants. And so that's something that we'll have to follow the science on over the longer term. But I want to make sure amidst all of the scientific developments that we don't lose the very clear public health message for New Yorkers, which is that vaccines work, including against Omicron. It's very important for New Yorkers to get vaccinated to prevent severe disease, and it's particularly important with Omicron if you're fully vaccinated to get your booster dose.
City and State, Jeff Colton.
And I just want to add what the doctor stated, because the doctor is so important what you just stated. Vaccines, booster shots, prevent, and it does an amazing job to prevent death and hospitalization. That is our best tool in the arsenal. And so if people state, I have a booster shot, but I still got the virus, the facts and data shows you're less likely to die and be hospitalized. That is the most important things we must understand. That's why we keep saying booster shots and vaccines. That is our potent weapon.
City and State.
Thank you. I'm hearing a lot of continuity from the last administration to this one, obviously with the same health commissioner for now, but it's a new administration, new mayor. What are the changes that you say that you're making to the city's COVID-19 plan from the de Blasio administration to the Adams administration?
Well, I think it's a combination. First of all, we believe this administration has done a good job in addressing the virus. I believe we're going to really improve on communication. That's the number one thing I heard. If I was to critique any part of what was done, many people found out information after the fact. I don't want to do that. I want to make sure I speak with the stakeholders, and I'm going to have a vast communication network that's going to ensure our credible messengers. You heard me talk about it often. The census teams, they can do an amazing job to do this in multi-languages. This is not only an English-only speaking city. And we're going to lean into those second shots. Many people took their first shot, but if you do an analysis, there are too many New Yorkers who have not received their second shot. We're going to send a clear message that it was supposed to have been received in a 45-day period. Some people have not done that. And so we want to make sure that not only the first shot, but the second shot, and we're going to do an analysis to determine if we should make the boosters mandatory as well. But we think this is the way you should fight this virus, is to have a seamless transition, analyze what was successful done in the previous administration, keep on team members to have a seamless transition, and then see how do we move forward with it as well.
We're going to do WebEx questions now. Daily News.
I'm sorry. Yes, someone in the back. In the back.
Oh.
Yes.
Yes. Go ahead.
Thank you. I'm Christy with WCBS 880. Just wanted to know on the vaccine mandate for private sector workers here in the city, which de Blasio said is probably the boldest in the nation. Any comment you can say on how that's going right now, what you think of it in terms of keeping that, what you want to change in that, anything you can say on that now? And I know Dr. Choksi said previously that it will be revisited. When will it be revisited? And just what do you think of it and what you might change?
Thank you. The mayor put that in place on the 27th. We are going to keep that in place. We spoke with our business leaders today to let them know we're going to keep that in place. And this virus is ever moving. And as we continue to examine...
Hi, Kimberly. Thank you so much for that.
Someone is having a lot of fun.
Sorry.
It's all good.
Oh my goodness! I am so sorry.
as we continue to look at the evolution of this virus, there will be moments when we can change some of the mandates. I would love to get to the day when we won't have children wearing masks in schools, when we won't have families needing to sit in a restaurant or visit other locations with the vaccine cards. We're going to make those adjustments based on what the science tells us when we can remove some of the mandates, and there may come a time if a new variant comes where we have to increase mandates. And so right now we're going to maintain what was put in place for the business community that was put in place on the 27th. We're going to continue that. And if there's a moment when we can change or alter that, we're going to do so based on the science.
Thank you. We are going to do daily news on WebEx. Chris Sommerfeld.
Yes, hi, Mayor-elect, can you hear me?
Yes, I can.
Good morning. I wanted to follow up on the question that was just asked about the private sector mandate. When Mayor de Blasio announced it, he said he also wanted to focus on education as opposed to enforcement and fines. So I guess I just want to ask, do you believe that you're doing something differently than that, or are you just following the same track? And as a follow-up to that as well, do you believe Mayor de Blasio has done a poor job of doing education as opposed to heavy-handed enforcement?
I am going to really expand on the communication and education. I don't believe we need to be heavy-handed with our businesses. COVID has been heavy-handed enough with our businesses. COVID has traumatized our financial base, restaurants, small businesses, corporations. It has traumatized. I think the right partnership, what we are doing now by speaking with our large businesses and our small businesses, we're going to receive the level of cooperation we need to ensure that we get the compliance that we need. And I believe if there was one critique, as I stated, I think that the mayor in the state of urgency which he was faced, we could have all done a better job in communicating with our various stakeholders around unions, around businesses, large and small. But I understand clearly what the mayor was going through at the time, and we need to be clear on that. He was dealing with increased hospitalization rates, deaths. We saw morgues being set up in parking lots outside hospitals. It was a very serious time, and I commend him. While being in the eye of the storm, he made the decisions to save New Yorkers, and when you match that with science and what our scientists and doctors and medical professionals have done, we did an amazing job as a city and as a country. And so we can always look in the rearview mirror and say what we can do better, but I commend the mayor and his team for what they did to get us through a very turbulent period in our city and in our country.
Next, we have Laura Nemes, Bloomberg.
Hi, Mayor-elect. Can you hear me?
Yes, I can. How are you?
I'm okay. Thank you. I wonder, both you and Mayor de Blasio have said that you really don't want to shut down anything in New York City again, but we are seeing, because of the Omicron, a wave of sort of de facto shutdowns, the closure of these CityMD sites. Several train lines are not operating, shows are closing, restaurants are temporarily closing. Is there any way to avoid that reality, or are we just going to have to wait until it's over? And also, I wonder if, and perhaps Dr. Choksi or Dr. Vasan could answer, do you have any estimate at this point for when the Omicron wave might begin to subside?
So the answer to close down, I think we're being extremely smart. I'm going to be walking through the theater district in a little while to send the message that let's make smart decisions. We want the lights on Broadway to remain on, because not only for those who visit our great theater district, but it's a symbol. Broadway theaters being open sends a signal regional, globally. Tourism is a multi-billion-dollar industry for our city, and it's imperative that we send the signal that we are open and safe. That is crucial. And so when you look at some of the adjustments that we're making, those adjustments are being made so we don't have to close down our city. They're coordinated, they're smart. I encourage us to make the right adjustment as we get through this summer surge so we can get back to a full opening and operation of the city. So I commend those who are making those modifications because that is what it's going to take to get us open. And Doctor will answer your question, but I'm sure if he was able to tell you when, he'll be a multi-billionaire. We all don't know when.
You're exactly right about that, Mr. Mayor-elect, and I have a lot of humility because it's been very challenging to, to predict the path of this virus over the past 2 years. With that said, we are, of course, following the trajectories from around the world, particularly in South Africa, the United Kingdom, Denmark, and Norway, which are a little bit ahead of what we've seen in New York City, even though we are ahead of much of the rest of the country in terms of Omicron. So with all of that said, I think we should plan and prepare for a challenging few weeks, certainly through January, with respect to what we're seeing for the winter surge due to Omicron. But the other thing that I would say to echo the mayor-elect is that this is not something that we're just going to take passively. This is something that we have agency over, and particularly the parts of our plan to do with vaccination, specifically booster doses, testing, and slowing the spread. All of that will help us to mitigate and minimize as much as possible the effects of Omicron, and particularly the most devastating effects on our neighbors and family members. Thank you.
Thank you. Next, New York 1, Courtney Gross.
Hi, Mr. Mayor-elect. Can you hear me?
Yes, I can, Courtney. How are you?
I'm well, thank you. If you could let us know when you're going to do that walk through the theater district, that'd be great. But another point of clarification is, when you say you don't want the vaccine mandates for private employers to be punitive, are you basically saying that your administration will not be fining at all? And then just a second question really quick, going off of what Laura was saying, is, I mean, when you take a look at these COVID numbers every day, they're very alarming. I mean, we saw another historic level of cases yesterday. And one assumes, or it is starting to filter into our hospitals. And while you don't want a shutdown, is there any concern that at some point our hospitals won't be able to handle it and you'll have a much larger crisis on your hands for the 5 boroughs?
First, on the fines, yes, we will. We will fine those businesses that are recklessly not complying and just refuse to do so. And we're going to use a light-handed approach for those businesses that are attempting to comply and give them the support they need. That's the partnership we want to create. I don't want to be heavy-handed and punitive in this approach. I think that we have to get through this together, and those businesses know if we shut down, it's going to devastate businesses. And the way not to shut down is vaccination, booster shots. That is our weapon. Your second question, dealing with the overall approach to this, is something that I believe is imperative for us to do properly and with the proper coordination that we are witnessing here. We are in a real good place in that even when you look at the hospitalizations, the headlines may say we have an 80% increase, but let's be, facts are important because facts can spread fear and facts can also allow people to know that this is not at the place where we have morgues outside of hospitals, where we're seeing people dying at alarming rates. We are not where we were in the beginning. Many of those hospitalizations, and some of them I should say, is coming from basic hospital for medical reasons. That is part of the increase in numbers that we're seeing. seeing across the city. And yes, this variant is extremely contagious, as the doctors are saying, but we should also acknowledge the fact it's not the same as the first wave of COVID, where you were witnessing the number of deaths, the number of people who were severely ill because of the vaccine and the booster shots. The contagious nature of it is not meeting the same level of deaths and hospitalization that we witnessed before, and we need to be clear on that. Just about everyone in the people I've been communicating with who caught COVID, for the most part, they're home, they were vaccinated, they had their booster shots, they're stating that they're going through flu or cold-like symptoms. That is a big difference from what I heard when I was on the ground when COVID first hit this city. The overwhelming number of people were headed to the hospital, and some of the people close to me actually passed away. And so, yes, the numbers are high. Yes, there's a lot of people who are getting COVID, and we want to stop that from happening, but the outcome is far different from what we saw in the past.
Next is Gotham's John Campbell. John, you there? Okay, we go to the next one, Dana Rubinstein from the New York Times.
And I'm sorry, New York One, Courtney, you asked, we're going to get there.
You've been listening there to Mayor-elect Eric Adams as he unveils his COVID-19 plan. You can continue listening to that on our streaming platform, CBSN New York. The Omicron variant surge very much an impact as he takes office this weekend. The mayor-elect and his team outlining the 6 pillars that are the focus of his plan. They're vaccines, supporting hospitals and congregate settings, testing, treatment, slowing the spread, and safer schools.
The mayor-elect's message to the city was quite clear. We must stay safe and stay open. He says we cannot and will not shut the city down again, but the way we beat this thing is through vaccines and testing. The incoming administration says the private sector vaccine mandate will stay in place. They're also considering adding that booster shot to the current vaccine mandate. His administration plans to increase testing sites across the city and hand out 2 million higher quality masks in January alone. We'll have a lot more on Mayor-elect Adams' plan coming up on CBS 2 News at noon. For now, we'll send you back to regular programming.
This has been breaking news.